afternoon, everyone. It is officially 12 o'clock, and it looks like everyone has joined from the waiting room. So we're excited to have you back for our parent and family webinars, Family Fridays. Again, my name is Stephanie Maddox, and I am an assistant director in the Office of Student Involvement and Leadership, and I help coordinate these programs. And we're really excited to talk about health insurance and immunization today. So, one quick note, welcome back for those who came last week. For those who are new, we're excited to have you here. This QR code will take you to our schedule that includes all of our registration links, as well as the recordings that are on that you can view via a Zoom link or on YouTube. This QR code will also be available at the end of the presentation, so you'll have a second chance to scan it as well. But now I will turn it over to Karis to talk to you about student health services at Oxford College.
Thank you, Stephanie. So my name is Karis Pocock. I'm the Director of Student Services here at Oxford College. Starting today, our agenda, we're going to give a brief overview about student health services, the health insurance requirements, which is an Emory University policy, the health insurance waiver process, Emory University Student Health Insurance Plan, which we call USHIP, and the immunization requirements and forms. So student health services, we are located right here in this bottom picture. We call it the bottom of Murdy Hall Breezeway. Our phone number is listed. We do recommend for all students to keep this number and other important numbers in their phone so that they can call us when they need us. We also have an after hours RN call center number. So when we're closed, there's still access to a nurse triage line. And if needed, the nurse will get in touch with the providers who are on call. And I am one of those providers. Our website is listed here. You can scan the QR code for access for you or your student. And then during the regular school semester, we are open Monday through Friday from 9 a.m. to 5 p.m. Our last appointment is scheduled at 5, but our providers are here until 6 so that we can accommodate that last appointment. We are closed on the weekends, but again, we have our on-call service, and these summer hours after graduation until August 1st, we are limited for administrative duties only. So visiting student health services, all students can come to student health regardless of insurance. Sometimes there is a misconception that if you don't have Aetna student, you cannot come here, but all of the visits are covered with student tuition. That includes visits with our providers and other clinical staff. We are staffed by nurse practitioners, but we have a physician who oversees us and that we collaborate with regularly. Labs, vaccines, medications, any procedures or immunizations are free fee for service for those that do not have Aetna student. So what that means is we will bill the OPIS account that will be paid through OPIS. And then after that, submission for reimbursement can be made through your private insurance, and we can help with that process. We do offer comprehensive primary care services and women's health. We partnership with Atlanta student health staff and doctors for telehealth visits, nutrition, gender care, and more of their services. We also partner with any of the community providers for services and referrals. So for health insurance isn't directly handled through Oxford Student Health. We have a separate Emory Aetna USHIP department that is housed within Student Health on the Atlanta campus. But we do want to help our families with the insurance process. So all students must have health insurance that is valid in Georgia. The mandatory insurance waiver process needs to be completed through OPIS. This year we did streamline that, so it is open from about May 15th and then until August 1st every year. It's an opt-out process for that waiver process. So if you do not complete the waiver process, if you want your student to be included on your commercial insurance, they will be automatically enrolled in the Aetna student. So really encourage your students to go through all of their OPIS checklist and make sure that they fill that out if you're keeping your insurance. There is an audit process. So all the students who complete that waiver process, it gets checked to make sure that you meet criteria, and we'll go over that criteria in just a few minutes. The deadline again is August 1st. Criteria is available on the Atlanta Student Health website, but we also have information on the Oxford Student Health website, under insurance. You just click on that insurance title, the drop down, and then there'll be information there. You want to take a screenshot of this questions to contact the Student Health Insurance Office. If you're not able to give them a call, they do recommend email. That's their preferred method. So health insurance requirements, it is a long list, but again, it is available on the website. For the insurance plan to meet Emory University's waiver criteria, the individual plan needs to have a deductible that's no more than $2,500 per year or $500 per illness. And for some insurance plans, on the front or back of the card, it does include what that deductible is. So if you're not sure, you can always check your insurance card or log into your insurance website to make sure that it does meet this requirement. If you're not sure though, go ahead and go through that waiver process, and someone from our team will definitely take a look at it. If you do exceed that deductible maximum, you have to be enrolled in a health savings account. And then that allows you to cover medical and mental health care, because we do offer both services on the Oxford campus and the Atlanta campus. The plan needs to cover prescription drugs, and then it cannot exclude or limit pre-existing conditions. It needs to have 100% coverage for preventative care, including vaccinations. Again, this is for within Georgia. And then the plan provides coverage for emergency and non-emergency inpatient and outpatient care. So that includes like emergency services. Other requirements: the insurance plan must cover at least 75% of usual and customary charges in Georgia. It cannot have specific limitations. Again, that can be found on your insurance website. The insurance coverage needs to be through a US based claim administrator, and it cannot be part of a co-op type program. Oral contraceptives must be covered at 100%. And the plan, again, must cover both inpatient and outpatient mental health services. The plan is currently active and maintained through the school year. So that would be the same as Emory Aetna. It needs to be offered through August 1st until July 31st. If lost coverage occurs, you do need to notify Emory immediately, and we will work with you on next steps. I know that's a lot of information about health insurance, but again, if you have any questions, please contact us. We can put you in touch with the right people, or the Emory Aetna USHIP site. So this is the Emory Aetna USHIP coverage for in-network providers. The deductible is $200. The core network, $200 in network, $500 deductible, the max of what you would pay. And then out of network, $750 deductible. If your student needs a referral from Oxford Student Health for any specialty care, we do provide referrals to community providers, including a list of providers. But one of the ways that we try to make sure that a student is seeing a core network provider so that they don't have to go through that list is to refer them to an Emory Aetna provider near the Atlanta Student Health campus or within the Emory Healthcare Network. That does require a little bit of travel using the shuttle, but it will help with cost saving in the long run. And again, we are partnering with the Atlanta Student Health campus to make sure that we can offer additional services like telehealth, additional specialty services within their clinic too. The prescription benefits of USHIP are prescription for the 15, 35, 65 is the core network drugs in network, and then the 150 is for specialty copay. Within student health, we do offer prescription drugs that we would prescribe at a discounted cost for Emory Aetna and also for those who continue to carry your own insurance. Dental coverage and vision discount programs are included under USHIP. So USHIP starts August 1st and it does run through July 31st of the school year. This is a breakdown of the costs for the fall start students. And we did include the spring semester costs too. It is just a little bit more per semester if there's a spring start just because of the longer time, the 7 months. And then spring students will need to go through that waiver process for the fall start. So steps for the waiver site. Students are going to log into their Opus account, opus.emory.edu. They're going to enter their net ID like they have been if they've already logged in to check their checklist. Complete that emergency alert, select the Opus Health tile, and then upload your insurance ID information. That's going to include the insurance card. The front and the back needs to be loaded as well. So we want to make sure students have that when they're going through this process. For those who do enroll in Emory Aetna insurance, we do encourage students to print out or have a copy of their ID card prior to any appointment, because that is going to be needed if they schedule an appointment with student health. To access that, this is the website for Aetna, and then they're going to click on print ID card. The Emory Aetna ID card won't be available until that start of the coverage period, so August 1st. So we do verify active status of Aetna insurance only for people who continue or students who continue their regular insurance. We just ask them to upload their plan information, and we're going to show you that when we go over the forms. We don't verify that insurance is active. It's just so that if we order labs or if you do want to submit for reimbursement, we include that information plus our notes when we give that back to the student. Oh, I'm sorry. I'm going to raise my hand. The lights went off. Apologies. That's the first time it's done that today. And then, like stated before, additional services for outside of the visits, such as medication, immunizations, or labs, will be billed through Opus. We do offer a discounted rate for all of that, though. And then we can help students submit that for reimbursement through their insurance. And if parents, you have questions about that, you can also email us so we can help you with that process. So forms and immunization requirements. We do have 4 required forms this year. Online copies of the forms can be found on the Inside Oxford pages. The privacy practice or FERPA form and consents. The QR code is for just general Oxford FERPA information. Our FERPA insurance form, or excuse me, our FERPA form for student health is a little bit more specific to student health information. So we want to make sure our students are reading that very closely. On that FERPA form, they can include anyone that they want to release information to. If a student does not fill anything out on the FERPA with sharing information, then if they were to come to student health and parents call asking for information, we are unable to release anything, just as if you were to go to a regular primary care office. We would need that signed or a release of information. The other forms that we have is medical history form, evaluation and treatment document policy, and then the immunization history with TB clearance for portal. And we'll go through all of these individually. So immunization requirements, students are required by Emory University to be compliant with our immunization requirements. And we are guided by the Centers of Disease Control and American College of Health Association. They are part of the onboarding requirements to safely arrive on campus. And then we do have the link for the student health information and the required immunizations. This is what the Oxford campus immunization form looks like. It's very similar to the Emory University form that can be found on their website. It is separate from the health science form, which includes the School of Medicine and Nursing. Those are a lot more specific. So students and parents, make sure you choose the Oxford form or the undergrad form from Emory University. We will accept either one of those. And we do recommend to complete the Emory form because sometimes when you submit an old immunization form, it does not have all of our requirements. Sometimes things are missed, and then it takes a little bit longer to get that OPIS checklist completed. So 4 steps to complete the immunization record. You want to make sure you have a signed and verified immunization record. The big one that sometimes or is often missed is to complete that TB questionnaire, the screening questionnaire. Enter your dates online on our student health portal, and then upload your signed and verified records. Required immunizations include 2 MMR vaccines, a hepatitis B series that will include 3 or 4 shots, 2 varicellas, a Tdap vaccine within the last 10 years, meningococcal ACWY for living on campus, and then the TB clearance. It's not an immunization. If someone was born and lived within the United States, they only need to do a screening questionnaire, and they can submit that to their portal. Recommended immunizations that are not required, but highly recommended: meningococcal B, polio, hepatitis A, HPV vaccine, and COVID. So how to use the student health portal. This is what our Oxford web pages look like. The student's going to sign in with the blue box that's access the Oxford Student Health Patient Portal. They're going to use their net ID and enter their password. And this is what the login page looks like for the Oxford Student Health Portal. If it does not look like this, then students have logged in and entered their information to the Atlanta Student Health website. And they'll need to enter it again on our website, and sometimes vice versa. So the first thing they're going to do is they're going to click on My Forms in the header. This is a list of the forms that are required, but also we include the insurance information form so that if students want to start entering their required forms prior to the start of the year, like if they have a Blue Cross Blue Shield that they know they're going to keep, go ahead and enter that information now so that they don't have to do it again. The evaluation and treatment document is just, students have to accept this, and it's part of our policy that we do require students to, if they want an appointment verification slip, we can provide that at the office visit, but we are unable to provide excuses from missing class. Students need to work with their professors if they're missing class for any reason. Of course, if there's something that the provider says, I recommend you to isolate or quarantine in your room, we work with our academic services to let them know that this is our recommendation and communicate that to faculty. We also, within this evaluation and treatment document, just says that it also includes our late policy. We are within 5 minutes of anywhere on campus. If students are going to be late, we do ask that they call us or even email us to just let us know that they're going to either miss their appointment, be late, so that we can work them into another schedule. Or, if there's a wait list, that we can call the next student on the list. The medical history form, this is where we want students to get together with their parents to go over, did I have any illnesses when I was when I was little? Does mom or dad have any medical history we should know about? Grandma, grandpa, any heart disease in the family, diabetes, things that we need to watch for if a student comes in, things that we might want to test for depending on a complaint. This form also includes an emergency contact number. Who should we call if, knock on wood, a student needs to go to an urgent care or the emergency room? Again, this is our privacy practices and consent form that we already went over. And then for the immunization form, this is one place on the My Forms tab within our portal. Students are going to upload their signed immunization form here, but we do recommend to have that immunization form in front of them, enter all of their immunization dates, including if they did get their Men-B, that is recommended and providers will give it at that office visit. Go ahead and enter that date in here, even though it's not required. Include that immunization form and then submit the immunization form online. To check your OPIS account, we don't email all the students to let them know of clearance, because we remove the checklist once the student is cleared for their health clearance requirements. Their documents, all of their documents will go into a queue on our side of the student health portal. It may take up to 7 days to process. Usually it's less than that, but as July 1st gets closer, we do have an influx of paperwork come in, so it might take a little bit longer, but we do our best to email or secure message students of any missing requirements. Of course, if students have questions on their OPIS account, if they're not sure, they can always send us a secure message or an email. Now we're going to go over steps to send secure messages in the student portal. They're going to log into their student health portal using their NetID and password. And then on the header, they're going to click on messages. There'll be a drop-down menu to view messages or new message. If we send messages, students will have an email notification saying that they received a message so that they can view the messages here. And this is just an example of the messages sent, a subject line, when it was sent, and when the students read it. Again, this is just they can click on the subject to read messages sent from us. And this is very important because this is our main line of communication, because it is FERPA and HIPAA compliant within the student health portal. Read the messages. Students just need to click on the blue underline and the message will pop up for them. So to send a message, they can reply to the message by opening the original message and clicking on the blue box, reply to message. They can send a new message by clicking on new message under the messages header. They're going to send a message, enter the recipient. We do have a general Oxford Student Health staff that they can click because we know they don't know who we are yet. So just go ahead and use that Oxford Student Health staff and it'll go to all of the available providers and staff, what it is pertaining to in the subject line and just a message. And then they're going to click send. So next steps and transition of care. Next steps, make sure that if students receive a message that they submit any missing vaccination records via the portal, or they can email us at oxfordshs@emory.edu. They want to make an appointment with their healthcare provider to receive any missing vaccines or get any lab work done if that is needed for titers, and then submit those records to student health. Students can also get vaccinated during the student health vaccine clinics. If students do choose to go this route though, they won't meet the deadline of July 1st unless vaccines are not available from an international country. that would be the exception. If a student is traveling, we understand that that would prevent them from getting vaccines. We just ask that students let us know as soon as possible, because we try to order the vaccines early, and we want to make sure we have enough available for all the students who would attend a clinic in August. And then if there are extenuating circumstances for any reason, if a student needs an exemption, they should also email us as soon as possible, and we'll do our best to work it out with any student. Transition of care. We want to make sure that if students have a chronic medical condition, or if they're being seen regularly by their primary care provider for whatever reason, we want to make the transition to Oxford as smooth as possible. So please reach out to Student Health, either with secure message or using their Emory email, because that is FERPA compliant. We don't want to share any health information via a Gmail or Hotmail account. If it is sent via Gmail or Hotmail, we will ask students to send it via secure message or Emory mail, just so that if there is shared information, it's secure. But we want to start this process early. For example, we often get questions about if we can help students provide shots, if they have weekly or monthly shots that they need. Just send us a message with questions, or if they need additional care while they're on campus, we want to know. We are unable to prescribe controlled substances for ADHD like Adderall or Ritalin, but we can help you find a provider close to campus or get you established with a psychiatrist on the Atlanta campus. Helping your students adults. So this is a big thing for student health. We encourage our students to help create our plans of care for them while they're here and have an active role in their healthcare. So we encourage parents to help us with this. When we know being far away from home, sometimes or usually they are going to call mom or dad first that they don't feel good. We do ask that you encourage them to call Student Health with any questions. They can email us with questions to make an appointment early. We do offer telehealth appointments too, if they don't feel that they can come into the clinic, and we will offer that. Student Health cannot excuse students from class, so we want to make sure that they make an appointment with us early. We don't want them to miss class because they don't feel good, and we want to make sure that they can participate in as many activities as they want to while they're here and stay healthy doing it. And then also learn, but have fun at Oxford. This is a great place to be, and we do believe that they're going to have a lot of fun here. Questions to ask your student prior to leaving is, do you know your personal and family medical history? What are the names of the medication you take and why do you take them? Sometimes it's even great if they have a little card with their medicines and with any pertinent medical history, as they may forget. And then, do you know what your health insurance is? Sometimes, even though I know you guys go over it before they leave, when they come into our office, they're still not sure. So just making sure you go over this with them before they get to campus or before you leave after dropping them off. And then, of course, any questions, please don't hesitate to reach out to us parents. If you have questions, concerns, we will email you back, or if you want to speak to us on the phone, please don't hesitate to reach out. So I do see a question. What happens if the immunization information is past July 1st? Like if you submit it past July 1st, is that the question? If the immunization information is submitted after July 1st, as long as it's submitted before July 15th. We do recommend, though, if you know that it's going to be after July 1st, that you send us a message as soon as possible so we can work with your student for any reason. Like if, say, your annual physical appointment isn't until July 5th, that's okay. We won't prevent your student from registering. We'll make sure that we can work with them.
There was another question regarding Spring Start students. So, do Spring Start students need to submit their medical forms by July 1st, or will they have a later deadline?
Spring Start students will have a later deadline because one of the important things is that TB screening questionnaire needs to be done within 6 months before arriving on campus. There'll be another notification of when Spring Start forms are due.
There is another question about is counseling available? And so a short answer to that question is yes. We will have a later session with the director of our counseling center that goes more into details about what they offer. Karis, do you have anything to add to that, or did I cover it well?
So we have a great counseling department here. We do also partner with our counselors if a student needs medication, simple shouldn't say simple, will need medication such as an SSRI if they're already on something like that. We do prescribe that to help.
There is another question that talks about I saw that health forms on OPIS that seem to only be filled out if the student was in a nursing program. Is it safe to ignore those forms?
What was that? I'm sorry.
Yeah, so there's some health forms on OPIS that seem to only need to be filled out if a student is involved in the nursing program at Emory. Is it safe to ignore those forms?
Yes, do not, you do not, for Oxford, you do not need to fill out any nursing forms. If your student applied to both schools, you may want to check on that. But if you know that it's only Oxford, don't submit nursing forms.
There is one quick question that asked about that they missed the first part of this talk, and the talks will be recorded. So there, if you scan the QR code that's on the page, you'll be able to view on the second page, there's a link to the YouTube recordings, but also there will be a Zoom recording. The Zoom recording typically goes up a little bit faster than the YouTube one. So I just wanted to go ahead and share that information. And then there's a second question that asks, say their student has medication that they take, can they keep it in their dorm room, or does it need to stay with the nurse in the office?
No, we actually recommend students to create a mini first aid kit prior to coming on campus to include things like Tylenol, ibuprofen if they're not allergic to those things and they take them at home, a thermometer, Band-Aids. If they take regular medication, they can keep that in their room, prescription medications. We recommend to keep that on them. If there's anything that needs to be refrigerated or mailed, to keep in the refrigerator, if you're unsure if a student will pick it up on time, we do work with families and students to have that medication mailed to student health directly, and we will hold it for them to pick up. We also partner with a community pharmacy, Carmichael's, so that medication can actually be delivered to us on campus so that students don't need to drive off campus to pick up prescription medication. And that can actually be sent from our providers or any outside provider if a student is on medicine.
There was another follow-up question regarding the nursing form. Since it doesn't mark it as complete, is that something that, again, like it won't be a problem for them, correct? Like they can just ignore it even though it says uncompleted in OPIS?
I would, for that, I would actually recommend to contact the office of admissions. There may be something going on with your student's OPIS account, because I don't want that to penalize them in any way. I don't believe it would, at least from the student health side, because our student health checklist on OPIS is Oxford specific. But definitely check with the office.
Cool. Thank you so much. I don't see any other questions in the chat. So I really appreciate everyone joining us today. We'll stay back for a few minutes in case any other questions pop up. But again, make sure to scan the QR code to view our upcoming schedule. Next week, we'll have campus engagement and involvement. And then on June 23rd, this will be an accessibility services question. So the Office of Accessibility Services, so typically also known as accommodations. And so this will be a joint session with the Atlanta campus that you don't need to register for. And yeah, so thank you for joining us. I see there's also one other question, so we'll go ahead and answer that as well. So if there's an EpiPen for food allergies, are there trained personnel? Do students just need to carry those items with them? Any recommendations for students that need EpiPens for food allergies?
Yes. Keep the EpiPen with them at all times. Carry it in their bag, in their purse. Our staff is trained to use EpiPens. We have EpiPens in our office as well. And I believe Emory police who are on campus are trained to use Epi. We do have extra EpiPens if needed in an emergency, but always carry those emergency meds with students. And then if they need a refresher on how to use the EpiPen, we are available for that too, to go over it with a student, because that can be scary if the time ever arose to use it. And then I can also stay on if there are any additional questions.
And then one other note with the EpiPen for food allergies question, we will have a session in July. The July schedule hasn't come out yet. But dining will be present. And so you can also ask them in terms of like EpiPens for food allergies, specifically with the dining hall. I also encourage you, if you want to go ahead and reach out earlier to like talk with the dining staff. I know that they typically will like offer to like meet with students and things like that if they have specific questions related to food allergies or just their needs in the dining hall as well. Again, thank you all so much for joining. We will stick around if there's any more questions for a few minutes, but I hope that you'll have a wonderful day.
Thank you.